All right, so I'm the last one today. I have the lucky privilege to talk to you guys about an area that's a little unique in pharma. So you may be thinking, we just heard about a lot of really exciting things. We just develop a new drug, so do clinical research. We file it to the FDA or other regulatory bodies and get it approved. We educate our consumers and we educate our providers to actually prescribe the drug. But you may be thinking, wow, that's great, but who's going to pay for this? And what are we going to do when, let's say, the federal budget is not going the way it should be going? So this is kind of what my group focuses on. So I'm going to talk about two different groups that really deal with the payer side of the business, or the insurance companies. The first of which is my position, which is policy and advocacy at Bristol Myers Squibb. And I think I forgot to introduce myself, but my name is Mina Alsaraf. I am a 2010 graduate of Purdue University in Indiana. I know there's one other Purdue, one other Boilermaker here. Woo, boiler up. And no, Ohio State is not going to beat us, thank you very much. But anyway, so that's policy and advocacy. And then the second area that I'm going to talk to you guys about today is something called health economics and outcomes research, or HEOR, also known as health services, all those different buckets of names. And they're a little different, but we really look at proving the value of our product to the payers. So let's begin with health policy and advocacy. So I just put this slide over here to give you kind of a diagram of what policy and advocacy is, and this is just Merriam-Webster's definition of it. But policy, and I mean, when you think of policy, what do you think of? You think of the government, and that's exactly right. So working in public policy areas within a pharmaceutical industry, we deal with the public payers. So when I say public payers, it's what? It's your Medicaid and your Medicare. So Medicare can be broken down into Medicare Part B, Medicare Advantage, and prescription drug plans, or Part D. So those are your public payers. And from an advocacy component, it's really working with advocacy organizations. So if you have a strong belief in something, you're going to advocate for that, whether it's through grassroots advocacy, whether it's through involvement in your professional societies. So APHA, for example, is American Pharmacists Association that many of you are probably a part of. That's a key advocate for pharmacists. ASHP, also key advocate for pharmacists. But there are some advocacy organizations that advocate for patient needs. So whether it be American Heart Association or whether it be lots of different ones. I can go and name a bunch of different ones. So advocacy within a pharmaceutical industry really focuses on pharma's partnership with these key advocates, whether it's a patient advocacy organization or a provider advocacy organization. And so I'm going to go into a little bit more detail about what exactly your day-to-day roles would be in this type of position. So from a policy perspective, one of the things that I've been able to do is work on different issues that are coming up. So one example right now that many of you are probably seeing or hearing about if you work in a hospital is the drug shortage issue. That's a huge issue that is impacting not only the pharmaceutical industry, the branded and generic pharmaceutical industry, but every single person in healthcare, including the patient. If they can't have 5-FU or leucovorin, then how are you going to treat them? It's affecting clinical trials because that may be the control arm of a clinical trial. So one of the things that I've been able to do is draft an internal policy to educate our key internal customers on how to address this issue. Sometimes I've also been able to draft congressional briefing documents. So if I have my federal lobbyist is dealing with an issue and says, you know what, Mina, I really need a statement, I need a leave behind. When I go meet with that staffer, I need to give them something to educate them on some of the key issues that we face. So what I do as a clinical pharmacist, having my PharmD hat on, a lot of times I do go into PubMed and pull a lot of literature and educate myself on, okay, what are the clinical arguments for or against this policy? And then I go and I talk to people. I talk to the medical departments, I talk to the commercial departments, and kind of understand more of the issues that are going on. And then I have to basically dumb it down so that a congressman or a congresswoman would be able to understand the issues. So that's some of the things that I've been able to do in the policy part of my fellowship. From an advocacy perspective, and advocacy and policy, even in that first Venn diagram, they meet in the middle. So they're very closely aligned, and it's really focusing on a lot of the key issues. So like for drug shortages, a lot of key patient organizations are interested about this because you know what? They're having patients who are essentially dying because they can't get drugs. So that's something that we may go talk to these organizations and say, hey, how are you handling this? Is there anything we can do? Because at the end of the day, no matter whether you get a job in industry or whether you go into retail pharmacy or you go and work in a hospital or whatever path your life journey will take you, consider the patient. And no matter where we are in industry, the patient needs to remain at the center. So when we work with these key advocacy organizations, that's one of the first things we say, is we're all in the business for patient care. And when we have that in mind, we really look for ways to strategically partner with them to address some of the main issues that they're facing so we can help patients lead better lives. So this is some of the things that we've been able to do in advocacy. Now, I know you guys are seeing a lot of these diagrams, and you're like, okay, well, everyone works with everyone in pharma, and that's kind of true. But some of the main internal customers that we work with are what we call managed markets. So what is managed markets? Other companies call it market access. It's really the payer arm of the business. So the payer arm, it may be dealing with commercial payers, so your Aetnas, your Humanas, or also dealing with some of the public payers, like the Medicaid and Medicare. We also work very closely with marketing, and specifically within marketing, I know Dr. Kim talked about marketing. The policy and advocacy deals very closely with payer marketing. So you have your consumer marketing, your professional marketing, and then you also have your payer marketing. So how to do payer partnerships. So my group deals very closely with the payer marketing arm of the business. Another group we deal with pretty regularly is external affairs or public relations, since a lot of times we have to have a consistent message externally as well as internally. And of course, medical, legal, et cetera. Two companies offering that are my company, Bristol Myers Squibb and Sanofi. So now I talked about policy and advocacy and kind of what we do from that end. Another group that deals with a lot of the same issues, proving the value add, or what pharma likes to term the value proposition for your product. So what's the value prop? What are you adding? So this group, the HEOR, or Health Economics Outcomes Research, likes to prove the value, or it needs to prove the value to a payer. So if you are developing this awesome drug for, let's say, non-small cell lung cancer, and it's going to cost, I don't know, $100,000+, but guess what? It's only proving or extending life by 3 months. Does the payer really care about that? And so this is some of the things that Health Economics and Outcomes Research likes to focus. So they may be proving the healthcare-related quality of life. They may be proving that, hey, you know what, you are increasing the pharmacy budget, but you may be reducing the medical budget. And at the end of the day, you are reducing cost spend. So that's some of the things that an HEOR fellow would be working on. This is a bit of a busy slide, but really what I want to, the day-to-day functions in this is really developing some of the research for it. So you will be doing, it's a technical role, and you will be developing some of that research. Sometimes you're developing it yourself and you get experiential experience in that, and sometimes you're working with a vendor. So you may say to a vendor or an agency, hey, I really need to prove the budget impact model for this, or I really need to improve, I need to prove to, let's say, a Medicaid payer why I need to pay for this drug. So that's kind of what an HEOR fellow will do. Another key role that they'll be doing is developing AMCP dossiers. So again, that and the budget impact model are two pretty crucial things that you'll be doing in this fellowship. Again, HEOR, a lot of the same internal customers. One of the major ones is your managed markets or your access strategy. These are two pretty big payer roles within the pharmaceutical industry, as well as your payer marketing. So they sit in different buckets within the pharma company, but whether you're in commercial or access strategy, you're both dealing with the insurance part of the company. Because HEOR does sit in medical, you do deal pretty regularly with your medical colleagues, since you are part of medical, and ensuring that physicians understand this. Because right now what we're hearing from a lot of physicians is they would love to prescribe our product, but guess what? They're losing a lot of their autonomy because of the step edits or the prior authorizations or the denials that the payers are putting on them. So that's something that an HEOR fellow would be working on. 3 companies are offering this year, 2 of which are new. So my company's offering a new one, Bristol Myers Squibb, we call it Health Services. It's a 1-year fellow. Sanofi is offering a new position as well. It's Global Evidence and Value Development. So again, what's that value proposition? So they're trying to prove that value add of their product. And Bayer's fellowship is combined with the medical communication, so a little bit of medical information, as well as the HEOR component. And we do have Dr. Ruth Kim is a current Bayer fellow who's in this.